Evening class, my name is Kimberly Harris, and I will be presenting Groups 3 of the Affordable Care Act presentation. To get started, let's just go ahead and introduce what the ACA is. Okay, so the ACA was signed in hopes of decreasing the total of uninsured people in the United States through its many provisions, which included new guideline taxes, decrease, and subsidization. The main goal of the ACA is to make healthcare affordable, accessible, and of higher quality. It was also intended that federal dollars be allotted for states to expand Medicaid. To briefly just skim through, those who were affected the most by ACA were those who were of young adults, those who are of minorities, and those who are with low incomes or part of low income families. So between the time of 2010 and 2014, the number of those uninsured dropped by 11 million. To add on the side, before the Affordable Care Act was passed by our former President Barack Obama, 47 million people were uninsured. So this was achieved by a person earning less than the federal poverty levels, individuals being able to remain under their parents' health insurance until the age of 26, people who have pre-existing medical conditions who couldn't afford it beforehand, and those who lost their coverage due to loss or change in employment. The exchanges. Within the ACA, there are four types of exchanges. You have the state-based marketplaces, which is present in 11 states, federally supported state-based exchanges, which is present in 5 states, states-federal partnerships, which is present in 6 states, and federally run exchanges, which is present in 28 states. And this is the highest exchange of all of them. It's important to note that the federally run healthcare exchange offers the same private plan options and subsidies as state-run exchanges. With implementing these exchanges came with people in states that were for it and those who were against it. Medicaid programs. So, what does the Medicaid program have to do with the ACA? Well, it offers healthcare insurance to low-income families. In conjunction with the ACA, healthcare is now able to be offered to more low-income families, and about 50 million more people will be eligible to receive healthcare insurance. The main goal of the Medicaid programs is program transparency and program integrity. With this, the ACA includes provisions that are designed to increase program integrity in Medicaid, including terminating providers that have been terminated in other programs, suspending Medicaid payments based off fraudulent allegations and investigations, and preventing inappropriate payment claims under Medicaid. Within this subtopic, there are five main subtopics under program integrity, and they include provider enrollment, pending investigations of credible allegations of fraud, recovery audit contractors, home health, and national correct coding initiative. Moving further along, we're going to talk about the premiums that are part of the ACA. So the 5 factors that determine a premium or someone's premium is age, which can be higher for those who are older than those who are younger, geographic location, tobacco use, which those who are frequent tobacco users can be charged 50% more than those who don't use tobacco, individual versus family enrollment, and plan category, which there are 5 plan categories. There are bronze, silver, gold, platinum, and catastrophic. Just skimming along, here is how insurance premiums are being affected by the ACA. With the passing of the ACA came with a lot of political views and debates and oppositions. One of them is the increased cost due to expansion of healthcare coverage, meaning healthcare costs for out-of-pocket and cost sharing actually decrease as enrollment increase. Physician defect and overworked providers. Newly covered sicker than already insured. It is also noted that it was difficult to assess cost and quality effects from the ACA in such a short amount of time since implementation. Since implementation in 2010, there has been over 50 attempts to repeal the ACA, but all have been unsuccessful. So, what are the key challenges that the ACA faces? Well, they are Medicaid expansion, which 4 million more Americans without health care coverage, as states did not expand the state federal Medicaid programs to cover people with incomes at or slightly above the poverty line. And here is this figure demonstrating exactly what was said in the previous slide. Then you have enrollment. 18 million Americans who are eligible to buy insurance in federal and state marketplaces have not done so. This will cause rises in coverage in 2018. You have market stability. You have certain insurance such as Humana, Aetna, and United Healthcare, who are all profit companies that have to answer to shareholders pulled out of marketplaces altogether. And then you have Cigna, on the other hand, who expressed on not expanding its ACA business anymore. You have affordability, basically explaining the employee sponsor or employer sponsored health benefits whose values exceeds specified thresholds will be subject to an excise tax starting in 2020. Wow. Known as the Cadillac tax. And then you have political resistance, basically having no support from the Republicans. When the ACA was passed, only the Democrats from both the House of Representatives and the Senate were in support of the ACA, and there was 0% coming from the Republicans from both the House of Representatives and those of the Senate. This turns into feeling the repeal of the ACA and replacing it with the American Health Care Act. So you have the American Health Care Act versus the Affordable Care Act. So a good law for the American Health Care. Just going to go ahead and basically skim through these parts of the slides or these parts of the presentation. It is noted with this one that insurance companies cannot longer deny anyone coverage for pre-existing conditions. Business with more than 50 employees must offer health insurance. It lowers the budget deficit by 143 billion by 2022, which is a lot of money. So, what does the ACA do right? They create good models that aim to paying for value and not volume of services. Models include Medicare and Medicaid innovation and accountable care organizations. They have a public reporting of quality performance dating, which means that this allows the community to the access comparative reports on individual physicians through the releasing of Medicaid data. And then they have eliminating pre-existing conditions as a barrier to coverage. With having bipartisan support, it will allow individuals to purchase insurance even with pre-existing conditions, and will also allow children to stay on their parents' insurance until the age of 26. So, possible improvements to the ACA. Um, they can decrease taxes on medical device companies and pharmaceutical sales. They can include part-time workers in employer health insurance plans. They can remove the 40% excise tax for insurance plans with annual premiums exceeding 10,000 for individuals or more than 27,000 for families. So, ACA provisions to add. Here are some options that the exchanges can add. They can continue current exchanges, but make the penalties close or equal to less expensive policy on the exchange cost. Option two allows states to create and manage insurance exchanges and bands together in regional pooling arrangements to cover the uninsured. Option three is Medicare for all, which will be administered, such as Medicare today, will cover individuals that is not sponsored by employee health care insurance. They can they can expand Medicaid just to get the 20 states to expand Medicaid. That will help at least 3 more million individuals to get insurance coverage. And they can impose taxes on industries that are harmful to our health, such as e-cigarettes, tobacco, alcohol, and weed. With studies suggesting that with increased taxes, it will reduce excessive usage of these um, harmful substances. Last but not least, the ramifications of repeal and replace efforts. Of course, one of the main things will be millions will lose coverage if the ACA is ever replaced. Pre-existing conditions can be denied, which is a major issue if the ACA is replaced. To stay afloat, insurance might have to quit providing insurance or raise premiums for many or all of the people they insure. The Kaizen Foundation projected that if the pre-existing condition provisions is repealed, 52 million Americans could be at risk of being denied coverage in the future. And lastly, but not least, um, higher payments for Medicare 65 and up. This will restore higher payments for services performed under Medicare Advantage, will lead to higher premiums for individuals for this managed service. Preventive services provided at free cost would raise premiums, out of pocket costs, or both would be the reverse efforts to close the donut hole for prescription drugs. And last but not least, here are just the references used for this presentation. Just want to quickly skim through it. Okay, and with that said, I would like to thank you for listening in on this presentation. I hope you guys had a great time and enjoy